Welcome, and thank you so much for joining us here at the Yale School of Management MBA for Executives webinar with a focus on healthcare and a larger conversation with Dr. Howard Foreman, who is the co-founder and faculty director. Yeah, so my aim in the next 45 minutes is to really provide a broad overview of the program itself, and then to really dive deeper into a conversation with you, into the nuances and the specifics of the healthcare focus area. And then we have some good news that we want to share at the end. So if you stay until the end, you'll hear some really great news. And so thank you so much for joining us.
Thank you.
It is really an honor here. Do you mind if I share a few things about your appointments?
Very little.
Very little, okay. So not only is he the faculty director and co-founder of this program, but he also holds positions with the School of Public Health, the School of Medicine, Yale College, and is the founder of the MD MBA program, joint degree. And if that wasn't enough, also a practicing radiologist. And if you're not following him on Twitter at the Howie, now is a good time to start. So thank you so much for being here.
Not sure they want that, but yeah, thank you.
So can you tell us a little bit about your role with this program?
Sure. So, we pretty much made the decision to launch this program about 15 years ago now, and we admitted our first class 13 years ago, and for the first nearly 10 years, we were an exclusively healthcare-focused program. Our vision at that time, and remains the same today, was that we would like to educate leaders for business and society, and particularly within the healthcare sector, so that the people that are making decisions about healthcare delivery, about healthcare access, about healthcare quality and cost in this country have a strong foundation in management science and leadership, and are put in a position to enable positive change. And that vision has continued to this day. We're proud not only of this program, but the other programs in our overall Yale University portfolio, which includes our undergraduate programs, our MPH programs, our nursing programs, and so on, all that have some deeper dive into healthcare management and leadership, but none more specifically than the EMBA program for healthcare. Over the last several years, we've obviously expanded to have non-healthcare tracks as well, and this has only enhanced, I think, the opportunities for our students in interacting with students that are not exclusively in the healthcare track, while still having a cohort that they can relate to, learn from, and interact with while they're on site and in between class weekends.
Yeah, thank you. Yeah, it's certainly a legacy that has been built here and continuing to be established. So you mentioned our mission, which is to educate leaders for business and society. And one thing that I would continue to add to that is that all of our students, our alumni, our faculty, and our staff are really focused on this mission, because it plays a huge part in the work that they do within their current organizations, within their communities, and then even beyond to the global reach. So I'm glad that the healthcare focus has really kind of been the impetus. It's really hard to find somebody in the healthcare when they're looking at this program that they wouldn't be mission driven, because it's really just the nature of the industry and the sector.
It's absolutely true. I mean, 45% of healthcare spending comes from taxpayer dollars, and the other 55%, I'd say, is still very much, purposeful and mission driven. Dollars from the private sector. Everybody has a stake in it. It's a almost $3.5 trillion healthcare economy right now, and there's a lot of work to be done.
Mm-hmm. Thank you. So you mentioned earlier how proud we are to be a part of Yale University, and so Yale University has delivered education to countless leaders, including numerous senators, 5 presidents, 10 Supreme Court justices, 20 Nobel Peace Prize winners, and is home to very well-renowned doctors and lawyers and architects, artists, writers, you name it, across all areas. And for those who are trained at Yale within healthcare or the healthcare policy, and also scientists, they're really at a place where they're making huge discoveries that are really shaping the nature of the industry and also the quality of care for patients. Can you speak a little bit more about the training that our healthcare professionals undergo?
Yeah, I'd say, if you look at other disciplines, there's overlap with business and management and leadership. In healthcare, there's a lot less. Particularly our physician applicants have almost no exposure to business and management before they come here. We have a lot of scientists that come from the life sciences industry that have had no experience in business and management leadership. And then we have others who have actually had sequential levels of responsibility within a firm, but don't have all the disciplines and don't really know how to integrate all the disciplines in a way that will foster their career and also the success of their business or entity that they work for. And our program fits that very important niche. I mean, we've now graduated, probably, I guess, about 250 or 300 healthcare students at this point. And if you look back there, I would have a hard time finding anyone that doesn't think that we had a strong and powerful positive impact on their career and the success of their firms. So the proof is really in the pudding, and we're very pleased with the outcomes.
Yeah, thank you. Yeah, it's nice to see our alumni who come to the healthcare conference, which we can talk about a little bit later on. So even though Yale University is quite old, it was one of the 3 founded universities prior to the United States becoming a country, and even has 4 signatories on the Declaration of Independence as Yale alumni. Interesting fact. Yale SOM is actually quite new. It was founded in 1970 with a very unique and novel mission at the time. And what we've seen is that continuation of innovation and reimagining business school curriculum throughout. So it's exciting. The photo that you see there is Evans Hall. This has been here for we're going on our 4th year, newly inspired. And you probably saw the change from the home that we had on Hill House to Evans Hall. Has that made much of a difference in terms of?
The space is just phenomenal. I don't think any of us that worked and lived in the old buildings realize just how important space can be. But Evans Hall is a great place to convene. It's a great place to collaborate, to work, to meet, to network. And so because it is one of the most beautiful and most well done buildings on Yale's campus, it ends up being a place where students from all over campus do sort of study, work together, and just learn. And so it's been a very positive change for all of us.
Actually, I live in the same location as people who are in the nursing program, and they say they all try to come and study here as much as they can. So we have some really nice study spaces here. All right. So, you've mentioned a lot about what this program is about. There are some, key points here that I just wanted to share with our audience. The program really started in 2005, and again, like Howie said, it's been around and mostly had a focus on healthcare since the last 4 years, which we then included the sustainability and asset management track. But in that, we have quite an interesting structure to the program so that busy professionals can really take advantage of all of the resources here on campus. The format is unique. It's a 22-month program that is really hosted on alternating weekends. That's an every other Friday, Saturday schedule with 4 in-residence times, which will be 2 weeks at the beginning of your first year, another week that is required that is also a global week at the end of your first year, and then to kick off your second year, there's another week in residence. But this is a really structured format, and I'm wondering what you've noticed in how healthcare professionals and leaders really manage to make this work, because it is a delicate balance.
Yeah, so one of the things I tell all of the candidates when I meet with them is that you have to be physically and mentally prepared and here every day. And that's not easy. And I think in the first 2 weeks when our students arrive, they're in various degrees of, denial about the fact that they're in school again. And a lot of them, I think, do struggle to cut the cord. But I think that they do successfully do that. I think, whether it's via peer pressure or just being the demands of our program, they do successfully do that. And it's a very arduous program. I would never try to talk somebody into this program on the basis that it's going to be easy or a cakewalk. It's a real commitment for those 22 months. But the effect, the impact, and the outcomes on our candidates are so positive, so strongly positive, that our students are willing to do that. And when they leave here, they find themselves with abundant free time because they never realized how much work they were putting into this program until it's over.
Yeah, we have one of our alumni who was here on campus last year, and she works in global public health. She said that her capacity was extended beyond, so that she actually feels like she has more to give to the industry itself and the work that she can do across her organization. Yep. So where does all of this happen, right? So we are in lovely New Haven. We're positioned today in a classroom in Evans Hall. New Haven is located really well between Boston and New York, but our students come from all across the US, and some even travel from places like Monterrey, Mexico, or Alberta, Canada, and even places like Norway and Germany. So there's plenty of options to get here quickly, and New Haven is a really gem of a city in terms of the diversity and the access to so many music and arts and lectures and thought leaders. So I know that you've been a long time resident around the area. What are some of the highlights for you?
Yeah, so I love that we're on one campus. And so, I came here 40 minutes ago. I left my office in the medical school and walked my way over to Evans Hall, which are two of the furthest points on campus. And still I can do it in about 22 or 23-minute walk. There is just so much on this single campus and so many amazing people visiting campus every day, either for guest lectures or part of Colloquia and so on, that the opportunity to be at a place like Yale where you can hear from a Bush or a Clinton or a Kissinger or a senator on almost any day of the week, you're going to have somebody at that level coming here. So for the students that are more regional, when you're enrolled in the EMBA program, even though you're not here Monday to Thursday, you're certainly a student Monday to Thursday, and you're allowed to come here Monday to Thursday. And so for the 70 or 80% of our students that are within a commuting distance of here, it adds additional opportunities. And for those that aren't, there's still lots of things going on Friday, Saturday, and extending into Sunday even.
Yeah, so we've been asking this question on our webinars. Do you have a favorite pizza spot? Because it is, New Haven is the pizza place.
Yeah, so, I have to say I've still not been to Sally's. I think Pepe's is very good. I'm not someone who thinks that's the only place in the world to go to. My sort of favorite place is probably Bar Pizza, which is downtown, and Moderna Pizza is probably my second favorite in terms of accessibility at least. But it is true, you can't walk 2 blocks in New Haven without coming across a pizza place.
That's true. Yeah, so if you haven't tried Delegna,
I've not tried that.
Give them a shot too.
You'll tell me later.
Yeah. So just to provide a quick overview of what the class weekend looks like, it's pretty packed. So there are 4 different classes each weekend. And lunches are held, between 12 and 1 and 11 and 12 on the different days. We also have Colloquium speaker series. Howie was referring to all of the different options that we have for really extending our lines of sight across campus. So we have wonderful people on our program team who basically facilitate and coordinate all of the cross-campus activities, which might mean a hockey game on a Friday evening or a trip to the planetarium or to Sterling Library or Beinecke. And then also on Saturdays after class, there are some workshops that are led by professors, not only from the Yale School of Management, but also from the School of Drama, from the law school, who will come in and ultimately share some insights in a shorter format. And this is not necessarily a part of the structured curriculum. It's just added enrichment, I would say. And our students all are really excited about these courses, so some of them will even stay late if they're traveling from afar. But I know one of the highlights for many of our students in the healthcare focus area are your lunches. So I wanted to see if you could share a little bit more about what inspires those and what are they about?
Yeah, I think the thing about healthcare, distinct from a lot of other disciplines, is that it's so active in the news. There's not a day that goes by that there's not either a merger announcement or a new innovation announced, or a change in federal or state policy that does afford the ability to have a more open discussion and dialogue. And we have a very diverse group of students that come here, and so voluntarily our students sort of pick these 4 or 5 Fridays during the year when we don't otherwise have colloquium to sit and just have an open-ended chat. And as I've pointed out to them, it doesn't mean that I have to lead it. It doesn't even mean that I have subject matter expertise in it, but it means that our other students are willing to bring that topic into the room and that we'll have an open dialogue about it. And it's worked out very nice. We've been doing it now this is the 3rd year, and the students seem just as energized and enthusiastic as before.
Well, and I do want to talk about the Colloquium speaker series as well. That's a few slides down.
Sure.
So I'll look forward to jumping into that. Thank you for that. Mostly because I want to sit in on those sometime and hear what the conversation is about. So one thing that's new to our program as of a couple of years is really this idea of extended classrooms. So students who have incredible commitments or emergencies come up, or they travel more globally and planning is a little bit difficult. They might have a special event happening. We've offered the extended classroom. So at Evans Hall, we have this amazing state-of-the-art technology, and we have Zoom. So we're able to really beam students into the classroom if they aren't able to be here on campus. Now there are some very strict guidelines around that because we want to keep the community and the culture intact. And at the same time, we want to offer some flexibility if needed. So you'll see on the slide some very clear photos of our students as they engage and professors call upon them. And it's really a way for them to continue to be engaged with the classes. So have you taught a class where we've used Zoom?
Certainly had students beaming in, and I think it's an incredible feature for students to be able to have as an option. We keep it obviously as a limited number of students in any class weekend, which I think is good, and it allows every one of our students to have the opportunity to know that when emergencies arise, that they still can be part of their class.
Yeah, thanks. All right. So this is really a high-level overview of what the curriculum is all about. So what I want you to take away from this slide is really that the program is 75% general management with another 25% focus on one area. So within the full 2 years, students go through leadership curriculum. That would include a couple of classes, one in their first year and then one in their second, along with coaching and peer coaching and a number of different opportunities to really expand that, but it's woven through the entire curriculum. So our first year students will participate in the integrated core curriculum, which is the same as the full-time students. So it's the same content, the same overall curriculum, the same faculty, the same rigor, as you mentioned before. And then in their second year, they have opportunities to have a little bit more flexibility with advanced management courses, which we'll discuss a little bit more in depth, and then a self-directed study. And then they're in their healthcare area of focus. So I guess my question for you as we move forward here is to talk a little bit more about how the integrated core curriculum really shapes the thinking or the insights that our healthcare students have as they develop as professionals.
Yeah, so first of all, it should be noted that the curriculum that they're following is substantially identical to the curriculum of our full-time program in every way, shape, or form. And so that if I look at my full-time MBA students who are in healthcare, either explicitly or implicitly in healthcare, they take almost the exact same curriculum. They're taking almost the exact courses that we're offering or offered in the full-time program, and they basically are doing that. There's a little less flexibility in the EMBA program because we define what the curriculum is, but the reality is that in the full-time program, they're mostly choosing these classes anyway. We introduced a new curriculum for the full-time program around 2005, I believe. And we waited a couple of years to introduce that into the executive MBA program because we wanted to make sure it worked well. We wanted our own faculty members to feel comfortable with it. And then we quickly moved it into the EMBA format. So while this to me is still a new curriculum because it was not in place when at least I first arrived here, we have over 10 years of experience with it in the EMBA program and more than that in the full-time program. And this is unique from other business schools. This is a way of viewing management and being able to respond to the different stakeholders that distinguishes it from our peer institutions. And our students come out of here, I think, all the better for it.
Mm-hmm. Thank you for that. What you see on the screen are the actual courses that students take through the integrated curriculum. And so you'll see that they're all given names of these stakeholder perspectives. So you might have a class called the customer, which would be team taught by somebody with a background in marketing, but also a background in organizational behavior. It's a really way to kind of collaborate, to really discuss value propositions or really understanding the customer that you're working with and how you might compete in the market space. At the same time, you might also take a class called Investor, which is taught by Roger Ibbotson, who will really impart the difficult skills, the hard skills, and the nuances of how investors make decisions, along with some of the broader thinking around how do investors think, how are they making decisions long term, and what makes a really solid decision for them that they can obviously invest their money in. So we hope that you're able to learn more through viewing more of the course curriculum online. But if you have any questions, we're happy to speak with you about this. I'm going to switch over here. So in your second year, you have an opportunity to take advanced management courses. There's a bit of flexibility infused in here. So you have an option to take financial reporting or entrepreneurship and new ventures, managerial controls or policy design. But there are certainly these 5 courses that are really, again, complementary to the integrated core curriculum. But they are designed to really kind of advance our students into thinking about some of these areas in a different way. So while you took customer in the integrated core curriculum, now you're really focused on the marketing and the strategy and thinking behind it. So what's interesting here is that these courses are taken at the same time that students start their healthcare curriculum. So I'm wondering, do these courses influence the conversation within the class? It's kind of a broad question.
Yeah, no, I think the curriculum is constantly provoking our students and prompting them to think in different ways than they did before. There's nothing more exciting than talking to our students after the first 2 weeks of in-residence, when seemingly we've given them a relatively small dose of management and business education, and yet they've already walked away sort of with their eyes wide open and recognizing how much they didn't know. I think the thing about business education is that unlike medical school, law school, a PhD program, you don't even know what you don't know. Like, you don't even have a sense for what you don't know until you're here. And I think this is just one more example. So there's no question that even when you're teaching a class, students are constantly bringing in concepts that they may have learned in the morning or the week before. And that makes it more interesting and more fun for all of us.
Wow, thank you. So this is also a fun area here, which is the self-directed study. It's a 4 credit hour area where you basically get to pick and choose how you want to utilize those 4 credit hours. So students have chosen independent research projects. They've chosen the Founders Practicum. And I'll explain a little bit more. I want you to explain the independent research project as it relates to healthcare, but we'll get back to that in just a second. So we have the Founders Practicum, which is led by Kyle Jensen and Jen McFadden through the entrepreneurship department here on campus. And so our students have an opportunity to really kind of dive into some entrepreneurial ideas that they might have. We've had 2 students, Wendy Davis, who's also a part of the healthcare focus area, who created Just Vision, and then also Alba Health, which is Sandra Saldana Ortega, who works on her wearable device that helps to detect strokes through asymmetries in the body. And at the same time, if they decide they don't want to do the Founders Practicum, students have taken language courses at Yale College. They've taken coding courses across campus, and they've also been a part of the selected courses that are held on Thursday evenings only for EMBA students. And the picture that you see on screen is a class led by Jessica Halfland on the art of leadership. And so all of our students can take courses all across Yale. They've taken classes at the School of Law, at the School of Public Health. It really just depends on the timing and the initiative. And then we also have options within the Global Network for Advanced Management to take a small networked online course. But now I think the time is to talk about the independent research project, which is something that you've led since the inception of the program, and I'd be curious to hear what students have done for that.
So, we've had an independent study requirement since the first year of the program at the request of the students when we were still trying to figure out the full curriculum. And remarkably, it really hasn't changed much over time. We've given them more options, but we have students that come here that have either lifelong passions that they want to pursue, or something new that comes up at work, or something new that comes up that just prompts them to be, inquiring about something new. And we've been able to structure a 2 or 4 credit course for them to be able to do while they're enrolled in our program, counts for credit and allows them to fulfill some type of life dream or sometimes a work experience. We've had students come up with business plans, marketing plans. We've had students write books and chapters, do sort of management research projects and so on. And the list is very, very long, as you can imagine at this point. And if anything, I think the quality and substance of the projects continues to get better each year.
Thank you. All right, so we're going to talk about one of the biggest, I think, and most one of the distinct features of our program. Our dean, Ted Snyder, helped to found the Global Network for Advanced Management, which hosts 30 top business schools across the world. And in that, there's partnership for a number of different occasions. So professors, obviously, students can interact through the Global Network Weeks. There's also the online courses that students are able to participate in with other students from across each of the schools. Our EMBA students have a required Global Week in June after their first year, and they're able to take courses at any of these business schools. Some of the most recent ones was at the University of Ghana. There was a state corporatization of social initiatives, and so this was really a focus on healthcare at the University of Ghana. I think Hiro Subashi in Japan led a course on the super aging society in Japan, which a number of our healthcare students took. And then students can take a class at EGADE in Mexico where they're learning about social innovation, or in Ireland at Smurfette on food science. So there's just a number of these different experiences. I wonder, because the Global Network for Advanced Management has been, with this dean, were there other global requirements at the time of when the program started, and how have you seen this change the nature of students' experience?
So for the full-time program, a global requirement was introduced in 2005 or 6, which was the international experience. And that has continued until just recently, and our students have been allowed to participate in that throughout the time as long as they weren't in class. And we did have healthcare-led international experience trips several times over the years.
Very nice. What do you notice when students come back from some of these trips? Does it bleed into their independent research project or other?
Occasionally they've done independent projects out of the international experience. But I think more broadly, I think any time that you expose yourself to another health system, to other markets, it really opens your eyes and your mind to other possibilities.
All right, so here we're getting to the core of this. So the other 25% is the healthcare-related curriculum and the colloquium. So Howie, if you don't mind sharing a little bit more. This is a photo of the annual healthcare conference, which is the largest student-run conference, and it's held here at Yale SOM at Evans Hall. Can you share a little bit more about this conference?
Sure. So this started, I think, about 15 years ago now. Roughly 15 years, maybe 16 years ago now, and it started as a very small conference with fewer people than you see inside that little breakout session. And in those years, we would get 50 or 60 attendees. Now we're up to over 500 attendees. We have 2 keynote speakers. We have an executive panel, and anywhere between 10 and 16 breakout sessions during the day, all held within Evans Hall. And this year's conference is on April 12th. The theme is yet to be decided on, but it's always a very sort of collaborative theme between the professional schools, the medical school, the public health school, the nursing school, and the School of Management, with some serious input from the law school as well. And we've got speakers from all over the country coming here, and we're very pleased to have just confirmed Dr. Vivian Pinn, as our keynote speaker from the University of Virginia, to be one of our 2 keynotes for this coming year. So we're really pleased with that. She's the founding director of the Office of Women's Health Research at the National Institute of Health. And I think she'll speak to the journey that she, as a woman and as a person of color, has taken in medicine over the course of her career.
Wow. Really exciting. Congratulations. Yeah. So this is really what you've curated, and I'm sure that it's changed over the years. But within this focus area, what do you really hope some of the learning what are the learning objectives, and what's the impact on students?
So, given that we're not a public health degree, we do an amazing job imparting on our students a core curriculum in healthcare so that when people leave here, they have foundational understanding of most of the healthcare disciplines, if not all of them in some way. Our newest addition is the population health, which is really a health data course. Our other area that I'm most proud of is global health, because for the first couple of years we weren't able to have a lecturer in global health as part of the program, and now for the last at least 10 years, I think we've had global health as part of the curriculum. And then we have both a healthcare policy and finance class, which is sort of a survey introductory class, as well as an advanced healthcare economics class, which is a deep dive and the application of economics to healthcare and how to think about a competitive strategy within healthcare. And then finally, we have our healthcare operations class, which is basically a deep dive in operations, all ending with what we could call a capstone course. We don't call it here, but Managing and Innovating in Healthcare Organizations is our capstone course, tying together the management disciplines and the different areas of healthcare. So in that course, you're going to have sessions on life sciences, sessions on healthcare IT, sessions on healthcare delivery and insurance, and at the same time tying in the disciplines of accounting and marketing and organizational behavior and so on and so forth. So really proud of the way the curriculum has laid out for us. We don't think, we're not able to give you an MPH, but we're able to give you something very close to that as part of a MBA curriculum.
Wow. And so you mentioned faculty earlier. Would you mind sharing a little bit more about the faculty that are here and hosting these classes for our students?
So all of our faculty are full-time faculty at Yale University, with one sort of caveat to that. Greg Licolai teaching the capstone class. The capstone lends itself to be taught by somebody who's in industry, and Greg is the chief medical information officer for a publicly traded company, and we're fortunate enough to have him come up and teach this class and teach in the full-time program. The faculty come from sort of a diverse set of backgrounds. Our global health course is taught by a pediatric infectious disease specialist. The advanced health economics course is taught by a health economist at the School of Management who is really one of the leading lights in the health economics area. Healthcare operations is taught by our deputy dean, who is a tenured faculty and professor in operations. I teach the healthcare policy and finance class, and the population health class is taught by the head of our equity research center in the medical school, who's jointly appointed to the School of Management, Dr. Marcela Nunez-Smith.
Wow. So this is a really strong and amazing group of people here who are leading.
And every one of them is committed to this program. They're not coming in to sub in for one semester. They're here for the duration.
Yeah, that's impressive. So this is something that you've curated. It's the speaker series for healthcare, and I know that we have a number of different people who have been speakers on our campus and you mentioned, all of the wonderful senators and leaders, thought leaders throughout who are here. So this is just another avenue to bring in some really well-renowned and respected thought leaders in the area. So can you tell, I guess, us a little bit more about, how do you decide who's going to come here, and who are the people that you're bringing in?
So we have a 2-year cycle, and we're typically allowed 8 speakers each year. So we basically have 16 speakers during that 2-year cycle. And the goal is to sort of balance life sciences with health services, with insurance and public sector, as at the same time that we're also balancing a diversity of opinion and diversity of background. So we'll have speakers that come from a medical background, from a non-medical background. Up on the screen now is Tom Scully, who is the Bush administration head of the Medicare program, or the Center for Medicare and Medicaid Services. In the middle is Mandy Cohen, a graduate of our medical school, who's currently the Secretary of Health and Human Services for North Carolina, but previous to that served in a leadership role at CMS under the Obama administration. And then Sachin Jain, who also served in the Obama administration, is now the CEO of CareMore Health, which is a large division of Anthem, and really a leading thought leader within healthcare delivery movement. For this coming year, we're fortunate enough to have speakers such as James Hamblin, who's the author of If Our Bodies Could Talk, and he's writing a new book right now. He has been sort of a thought leader in social media, and he'll be teaching a full-time class on the social internet and healthcare and health policy, so he'll be doing one of our colloquiums. Carolyn Clancy, who was the head of the Agency for Healthcare Research and Quality, and most recently was the executive in charge of the VA until she was asked to step into a lower role recently by our president. But she is still one of the leading physicians at the Veterans Administration medical centers. And she'll be our leadoff speaker for this coming year. We have Farzad Mostashari, who founded Aledade, coming as well, and blocking on some of the others, but we have really a good broad list of people coming again for this year.
Well, it's amazing. I hope that I'm going to block off my calendar to listen in.
You should.
Yeah. So we also, a lot of our students are coming from a lot of variety of backgrounds, as you mentioned, and I know that our audience is probably thinking, well, what would it look like if I were a student here, and what are they looking for in terms of, candidates that would be very strongly aligned with the program. So can you tell us a little bit more about the students that you've taught, and also, what are some of the expectations for building a class within healthcare?
So, we have an amazing admissions staff, including you, who have done a great job of building a class that is diverse in every possible dimension. I feared in the first few years that we would have too many physicians. That has never been the case. We do get a large number of physician applicants, but we've always been very careful not to overweight physicians in the class. I don't think we'll ever have more than 10 physicians in an entire class of over 70, and I think even 10 is probably sort of on the upper limit. There have been times we've had more life science people in a class. There are times we have 2 lawyers in a class, and then there are occasionally years with no lawyers in a class. So we're fortunate to get people with a diversity of backgrounds and a diversity of industries. We've had almost every major payer in our class. We've had almost every major specialist be in our class. We've had executives all the way up to the top of hospitals. And the range of age has varied from people in their upper 20s, which are clearly at the low end of what we consider, all the way up into their 60s. And some of our most impressive graduates graduated here either in their late 50s or early 60s, only to go on to have another career after that.
Yeah, actually, that's kind of my next question. Like, what do you see students doing once they've graduated from this program?
So the majority stay within their lane, so to speak, and they continue to grow within either their own company or at least within their own industry. But we have a significant number of students that do make what I call, and others would call, a serious career pivot, where they move from being a clinician to being an executive officer, where they move from being, a mainline manager to being an entrepreneur. We've had people start businesses. I'm sort of blown away by how many of our students are starting businesses right now. I met with one yesterday who has 2 classmates together with him in a business, and it reminded me that just 2 years after him was another class where there are 3 classmates in an ongoing enterprise that is a startup. So we have a good number of people moving into the entrepreneurial space. Our only preference is that people continue to be passionate about healthcare and a way to affect positive change.
Yeah, thank you. Yes. No, I mean, I think it's just, I say that a little bit flippantly, but I really mean that if we're going to live and breathe our mission, then that passion, that mindset to really do good in the world is so critical.
Absolutely.
Okay. So, good news. Yeah,
Very
this is
good
big
news.
news. So I know that you and others within Yale SOM and others at the School of Medicine have been working really hard on this. Would you mind sharing how
Sure.
this has come about and what you would like to tell the audience?
So we were approached 14 months ago to compete for a new program in minority health leadership. And it was my opinion then, and continues to be mine now, that we can have a very positive impact in this space. We already have. We have many faculty members on our campus that are already actively engaged in this area. And I think that we can have a multiplier effect by educating 3 individuals a year, 6 at any given point in time going forward, to afford them the ability to get an executive MBA program doing our program here, and at the same time, several other sort of parallel enrichment activities that will come alongside that. The program is going to be led by my colleague, Dr. Marcela Nunez-Smith, who is jointly appointed between the medical school and the School of Public Health and the School of Management. And we anticipate enrolling our first students next July. The application will open at the same time as our application today. And there's a checkbox in there if you're applying for this pathway. This will be a completely free program for those that enroll. They'll still obviously have to cover the expenses to get here and go back, but the tuition, the cost of room and board, all of the other sort of activities that are involved are all being covered by both the Commonwealth Fund through their generous support, as well as the School of Management, which has been matching that support almost dollar for dollar. We're convinced that this is going to be very, very impactful, and we're looking forward to seeing a lot of applications this year. Unlike a lot of other programs of this nature, particularly those that have the word fellowship in it, this is for early, mid, and even late career professionals. So anybody can apply for this. We are looking at clinicians only at the time, for the time being. So that means that generally speaking, that you're either a physician, a nurse, or a physician associate or physician assistant. I think that we would consider others that have a clinical background that don't fit neatly into those categories. But in general, that's what the foundation and what we have committed to for the time being. And we anticipate that, the ideal candidate is one who has already established themselves as someone with a career in minority health policy or minority health delivery, and is looking to develop the leadership and management skills that are going to be able to allow them to, move higher within the enterprise and have yet a bigger impact.
Great, thank you. Yeah, this is a great news.
Very excited, as you know, that we just announced this on Monday. We've been sort of holding this to ourselves for the last couple of months, but we're very excited about it.
Absolutely. So you're probably wondering what next steps might be for both the fellowship and also for the application. And so I would encourage you to reach out to us. We have a pre-assessment form that you can fill out where you basically provide us with your resume, your CV, or your LinkedIn profile, and we'd be happy to respond to you and share more with you about the program and your candidacy. And you can also come to join us here at Evans Hall on any weekend, well, one weekend a month, where we have an information session. And then we're also hosting one-to-ones in New Haven and in different regions. So you can check out our website on the events page for any of those. And then, as you mentioned, we just opened the application. So the application is quite simple. It's all online. It requires a couple of resumes and a couple of essays, and it also will require a couple of recommendation letters along with a standardized exam, which is either the GMAT, the GRE, or the executive assessment. We have no preference. You can take whichever one works best for you. We also really will need your employer's approval. We'll need some transcripts, and there's an application fee. All of the candidates that are moved past the application into the interview stage will be done by invitation only. And you can see some of the upcoming dates, which are November 13th, January 29th, and April 9th. Like how we said, for the Commonwealth Fellowship, Commonwealth Fund Fellowship, there will be a question in the application that you can check if you'd like to apply for that. But if you do have any questions, please feel free to reach out to us. We are within 1 minute of time, and I know that there have been questions coming in. Would you like to take one question before we wrap up?
Oh, sure. Happy to do that.
Okay. All right. So the one question is, it's about the Commonwealth Fellowship, and the question is the program targeted for persons from minority or disadvantaged backgrounds?
So the program is targeted at minority health leadership, and we will consider any applicants that are interested in that area. And so I think it will take all comers.
Okay, excellent. So I'm sorry that we've run out of time today. If you email emba.admissions@yale.edu, we will be able to answer your questions and help move you forward, making sure that you have the right information as you're considering business school education. And so thank you so much for joining us today, Dr. Howie. I always want to call you Dr. Foreman more formally, but thank you so much for being here. I really appreciate this.
Fun to do. Thanks.
And I just want to give a shout out to all the members of the media services team who are here and all of the admission staff who have been fielding questions and who have been present throughout this process. So thank you. Have a wonderful afternoon, and thank you for joining us at your lunch break. Thanks. Bye-bye.